It's Friday, December 24th, and the time for your Barbados Today morning news update. We begin with an update on the ongoing strike involving scores of this island's nurses. Barbados Today understands that the Unity Workers Union, which represents the striking nurses, will return to the bargaining table with Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, today. This time, however, an intermediary who apparently reached out to both parties will be working to break the deadlock. When contacted, UWU General Secretary Senator Caswell Franklin expressed optimism that once the matters were brought to the fore, a favorable outcome would follow. The union boss is also hoping that once cooler heads prevail, the docked salaries of the striking nurses will be reimbursed.
Who wants to hear me and to hear what I'm coming from, they ain't got the choice. Because we are not asking for anything unreasonable. Some of the things that we ask for might cost money, but it's not a lot of money.
Things like what?
Let me wait tomorrow.
Are you confident as well in that the government may reconsider its decision to dock those salaries?
Yes, that decision was made in an environment where heads were hot. I think cooler heads will prevail.
This Island Stop Cop says the Barbados Police Service will be paying closer attention to all firearm-related matters come next year. During his inaugural Christmas message, Police Commissioner Richard Boyce pointed out that even though it had been a challenging year, statistics showed serious crime had decreased by 24% when compared to the same period last year. He said firearm crime continues to be of concern, and during the coming year, all of the services resources, along with expected collaboration of communities, will focus on the matter. The Commissioner said the service would also increase its use of technology in a bid to improve efficiency. The Barbados Road Safety Association is appealing to residents gearing up to enjoy the Christmas festivities to be careful on the island's roads. So far this year, 16 people have lost their lives as a result of vehicular accidents. And BRSA President Charmaine Roland Bowen is pleading with road users to drive and ride with due care and attention in order to prevent the number of road fatalities from rising.
Again, we want to appeal to everyone not to let your guard down. This is Christmas. You know, people are going to be saying they didn't see their family last Christmas. They didn't do this. You know, we have a slackening of the restrictions. You may even find more people on the road than you did last year. And do not become complacent. Do not let your guard down. We don't want any fatalities. We don't want the accidents. Keep the accidents down.
There's regional and international news after this short break.
Hi, my name is Christian Paul. I'm the country manager of BCIC here in Barbados. When the COVID vaccine first came out, I thought it was an interesting and a potentially successful way for us to navigate our way out of the pandemic and a return to some state of normalcy. I took the vaccine because I have a young family. I want to make sure that they are safe and protected. I have friends, extended family, and obviously I work here with colleagues, so I thought it was a good way to help protect them and to keep them safe, as well as myself. I would encourage others to take the vaccine because I know that you can still transmit the disease even if you're vaccinated, but the chances of being severely ill or worse, dying, are significantly reduced.
Let's roll up our sleeves and get back to living.
To news from the region now, hospital officials in Bermuda are on alert as COVID-19 cases spike as a result of the Omicron variant. More in this report from Bermuda Broadcasting.
Bermuda's hospitals saw more pressure than ever before during the fourth wave of coronavirus infections 3 months ago. They are once more on alert following a sudden spike in cases driven by the new Omicron variant. A new UK study suggests that Omicron is 50 to 70% less likely to cause hospitalizations. There is, however, uncertainty about what will happen to older age groups, since current infections and hospitalizations in the UK are mostly under 40 years old. Here in Bermuda, hospital CEO Dr. Michael Richmond revealed that 6 months of intensive care drugs were used up in just 6 weeks during our last outbreak. What did the hospital learn from that outbreak if we ever face that same influx again, because the hospital had never faced that before.
No, the expert staff that we have worked long and hard, day after day, and were supported by staff who were redeployed from other areas, and that would continue to be the mainstay of our plan. But we're also reaching out to the UK. We believe that we have support from an agency in the UK to supply a limited number of intensive care and emergency staff.
Dr. Richmond said the hospital is well stocked with physical equipment such as ventilators and beds, and has restocked on COVID treatment drugs, although some emerging antiviral drugs are not yet on island.
And finally, on the international scene, the World Health Organization's COVID-19 technical lead, Dr. Maria van Kerkhove, believes that the world is still in the middle of the pandemic, but stressed that countries have the power to end it in 2022. She said vaccine equity must be a priority for every single government.
We need to also be able to use tools to drive transmission down, because if we don't, we will continue to see the virus change and the virus threaten us in ways that will bring us closer to the beginning rather than closer to the end. What we are learning about Omicron is certainly we have this increased transmission, but the information on severity is still uncertain. We don't have that complete picture yet, and it is too early to conclude whether or not Omicron is less severe than Delta or is as severe as Delta. Now, we do have some data suggesting that rates of hospitalization are lower, some information that people who are hospitalized don't need as much oxygen or invasive ventilation. But again, we have not seen this variant circulate for long enough in populations around the world, certainly in vulnerable populations. We did learn some information this week that Omicron, as it enters older age groups, older people with Omicron tend to have more severe disease. That's unsurprising. We know people have died from Omicron. It's too early to conclude.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.